Welcome back. In the last few weeks, the governor delivered his annual State of the State address. Now, in the speech, he announced a task force to study the healthcare workforce shortage here in Wisconsin. At the helm of that task force is a former registered nurse who also happens to be the lieutenant governor. Take a listen.
There's more that we have to do to address our healthcare industry's chronic challenges. Next week, I'll sign an executive order creating a new healthcare workforce task force focused on finding long-term solutions to our state's healthcare industry, and make recommendations for me to consider in my next biennial budget.
Joining us now is the Lieutenant Governor of the great state of Wisconsin, Sara Rodriguez. Thanks so much for joining us.
Thank you for having me. I appreciate it.
So I want to do a quick recap. We heard from the governor talking about his State of the State address.
Yes.
From your perspective, what is the State of the State?
You know, I think we're doing fantastic in the state of Wisconsin. We have one of the lowest unemployment rates we've ever had since we started measuring it, and the most people working, but we know we've still got work to do. One of the areas that I'm going to be working on are some critical infrastructure areas like healthcare workforce, which is one of the areas that he announced within the State of the State.
To get a sense of the problem, where are we in this kind of healthcare workforce shortage?
So I'm a nurse myself, and I've worked in healthcare for almost my entire career. And I know that we are lacking nurses within the hospital systems, within public health, within our clinics. The statistics say we're going to be missing about 20,000 nurses by 2030. And that's going to really affect the ability for people to get care in their own communities. And this healthcare workforce task force is going to be looking at nurses, but also looking more broadly at healthcare. What else do we need within the state of Wisconsin? There are gaps in a lot of different areas. And so making sure we're talking to everybody across the state, seeing what their needs are, and making sure we can put some solutions in place to meet those needs.
So you're mentioning 20,000 nurses shortage in the next 6 years or so. What does that look like in a clinic setting or in a hospital setting?
So it means that sometimes the nurses are overwhelmed, or hospitals cannot put people into hospital beds because they can't man them with nurses. So they may be able to have more capacity within those hospitals if they had the staffing that they needed, but they don't have it today. And so we want to make sure that nurses are well supported within the hospitals. All healthcare professionals are well supported within the hospitals, and that they can do the job that they want to do safely and take care of our community.
So when you talk about the task force, kind of what goes into that? Is it just you make a recommendation for legislation? Will you have funding that you can allocate?
So that is one of the areas that we're going to be working on, is to talk to the governor and give recommendations and say, this is what we would like you to put in your budget for this next cycle. But there could also be administrative changes that we can work with the different secretaries on. The secretary for DHS, the Department of Health Services, is going to be on the task force, as well as the Department of Workforce Development. And so there are areas where they could look at what they're doing administratively and how can they bolster that healthcare workforce.
So I don't know if this is what you're alluding to with some of these other issues, but we know licensing has been a concern, especially in Wisconsin, especially post-pandemic too. Yeah. The governor this week just signed a series of bills related to dental licensing, for example.
Yes.
Is there more work to do on that front?
You know, there's always work to do across for licensing, to making sure that people are working at the top of their licenses so that we can make sure that everybody is contributing the way that they need to within the state of Wisconsin so we can take care of our community. But yes, all of those things are on the table. We're going to be talking about them. We want to be innovative. We know that all healthcare is local, so something that might work in Madison, might work in Milwaukee, may not work up north Wisconsin. And so we want to make sure we are getting that input from all across the state.
What do you mean when you say working at the top of their license?
So making sure that if we have nurses working, that they're going to be able to have the support that they need. They're going to need certified nursing assistants to be able to work with them. Surgical technologists is something that we can have within the operating rooms. And we know that there are shortages there as well. And so if we have these support staff, then nurses can do what nurses want to do and can work at the top of their license.
So another big portion of the governor's speech was this notion of allowing broader access to over-the-counter contraceptive, especially for folks on Badger Care. What kind of impact will that have for Wisconsinites?
You know, I think that's going to be great because they're going to have standing orders, and individuals who are on Badger Care can go in and get contraception when they need it. It can go through their insurance, and they're not going to have to pay for that. So it really increases access all across the state of Wisconsin, and that's something I think we can all agree upon. We want to have more access to contraception in Wisconsin, and this is a way to be able to do that specifically for folks on Badger Care.
Well, Lieutenant Governor, thanks so much for sitting down with us. Appreciate it.
Thank you for having me.